So, good afternoon, everyone. I welcome you all for this awareness webinar on QAI accreditation standard for emergency department by QAI CHSC. So, first we'll be talking about what QAI is, its introduction to CHSC and programs, the emergency department accreditation standards, the QAI accreditation process, a step-by-step guide, followed by the question and answer session. So we are QAI, which stand for Quality and Accreditation Institute. Dr. Bhupendra Kumar Rana is a founder and CEO of QAI. He has over 25 years of experience in quality, standard development, accreditation, and patient safety. He's also the former director and CEO in charge of NABH Quality Council of India, where his visionary leadership transformed the healthcare quality framework in the country. He's also the founding member of the International Academy of Quality and Safety, IAQS. He is also the member of the Scientific Board Advisory Board, International Alliance of Patient Organizations, IAPO. He is also the Vice Chair-elect of the Mutual Recognition Arrangement, MRA, Council of Asia Pacific Accreditation Corporation, APAC. The former board member and chairman of the Accreditation Council of International Society for Health Quality in Healthcare, ISQA. He is also the international expert of the World Health Organization, the World Bank, Asian Development Bank, and the UN Framework Convention on Climate Changes. Uh, at QAI, our vision is to nurture the largest global pool of organizations and people through quality improvement and accreditation framework. Our values are listening, seeking continuous feedback from stakeholders to address their concerns, being competitive, looking for viable options to benefit users of our services, being transparent, clearly defining policies and making them available in public domain, and being innovative, continuously evolving using co-design and co-creation. Our mission is to conceive and deliver education, training, accreditation, and related programs in partnership with stakeholders using an approach of co-design and co-creation. Our organization has Center of Accreditation of Health and Social Care, CHSC, Center for Education and Training, CET, Center for International Accreditation, CIA, and Center for Accreditation of Veterinary Facilities, CAVF. Mr. Professor M.C. Mishra, he is the board chair and former director of AIMS, New Delhi, and a chairman for CHSC. We have over 20 plus programs. QAI becomes the first accreditation body in India to achieve the ISQA EEA accreditation in less than 5 years of operations. QA is also the first and only accreditation body in India having two standards accredited by ISQA EEA. It is also recognized by the Ministry of Health's central government health schemes for empanelment of private hospitals, eye centers, dental and imaging centers. Our international linkage is being the member of the International Council of International Society for Quality in Healthcare and the External Evaluation Association, ISQA EEA. QAI has its own accreditation mark. Now let's start with the emergency department accreditation standards. In general, we have a accreditation process starting with the self-assessment by the organization themselves, followed by the application, SAT, documents, and the fee. Then the review and registration and acknowledgement of application is done by the QAI Secretariat on receiving the application and the documents, followed by the review. There is an optional pre-assessment which can be done on-site, remote, or hybrid. An on-site, remote, hybrid assessment is being conducted after the document review. followed by a report review including scoring and non-compliances, if any, found. After the hospital is found to meet the score of the scoring requirements and submitting the corrective actions for the NCs found, if any, there is review done by the accreditation committee, including validating scores, accepting of the corrective actions. Once it's found to be complying with all the standards, there is the issue of accreditation certificate, which has a validity of 3 years. There is also surveillance that is carried out within 15 to 18 months of accreditation that can be done either on-site, remote, or hybrid. And a renewal of the application is done 6 months before the expiry. For the emergency department, we have many of the following hospitals who have been accredited by QAI, which includes Dr. Mehta Hospital, CMC Vellore, Apollo Hospitals, Vokat Hospitals, Thane, Rajkot, Nagpur, and Mumbai. Now let's start with the benefits of the accreditation. For patients, it's an accredited to have an accredited emergency department. Patient receives higher quality of care. The safety of patients is given a priority. Patient receives services by the credentialed medical and nursing staff. There is right of patients that are respected and protected. Patient satisfaction is regularly evaluated, which provides an opportunity to patients to express about their experience, and they get an opportunity to be a part of their own care. For emergency department facilities, accreditation helps the emergency department in demonstrating commitment to deliver quality and safe patient care. It also assures community about the quality of service and better health outcomes, and helps to demonstrate that the healthcare facility functions in transparent and ethical manner. It also acts as a potential mechanism of risk management to safeguard providers from potentially legal liabilities. It is a process to stimulate continuous improvement and act as a mechanism of self-regulation. It may provide opportunities for benchmarking by comparing the outcomes with other accredited healthcare facilities. For staff, the accreditation process provides opportunities for them at all levels for their professional development. It may also help in their building higher staff satisfaction because of the good working environment, leadership opportunities, and the ownership of the process. Being robust, documentation, and procedure in place, it also supports the staff in building their own confidence to deliver proper care. For the third party, it provides an objective system of evaluations and empanelment by the third party like insurance companies, other payers, government, etc. It also helps in ease to reliable and documented information on the facilities, infrastructures, services, and level of care. Objective of these standards is to provide a framework for quality assurance, quality improvement, focus on patient safety, and quality of patient care. These standards set for quality and safety that organizations must achieve to be revised periodically and raise the bar. It also helps in achieving international recognition. QAI accreditation standard for emergency department. The first edition was launched in May 2021, which includes 10 chapters, 62 standards, 245 criteria. There are 9 chapters, governments and leadership, containing 5 standards and 16 criteria, design and management and faculty management, DFM, containing 9 standards, 41 criteria, staffing and training standards, 5 standards with 25 number of criteria, information, education, and communication with 5 standards and 14 criteria, documentation and information management system with 9 standard, 24 criteria, continuous quality improvement with 3 standards and 10 criteria, triage, assessment, management, and disposition, 6 standards with 25 criteria, emergency medical services with 6 standards, 26 criteria, medication management and safety MMS with 8 standards, 34 criteria, hygiene and infection control with 6 standards, 30 criteria, making it 62 standards and 245 criteria. The standard framework can be depicted as follows. First we have the chapters, followed by the standards and the criteria. Starting with governments and leadership, each faculty requires a governance structure that is ultimately responsible for the quality and safety of services provided. This responsibility is derived from its legal identity and operational authority for all activities undertaken by the facility within the ambit of the applicable law and regulations. Each facility, regardless of its complexity, also has a formal structure. Leaders ensure that a system exists that promotes safety and quality, provision of services that meet the need of patient, availability of adequate resources, that is human, financial, physical, and monitoring the evaluation of improvement activities. The design and faculty management chapter uh, is for the ED with that will prevent people from receiving unsafe care and treatment and prevent unavoidable harm or of harm. The ED must assess the risk to people health and safety during any care of treatment and make sure that the staff have the skills, experience, and competence to keep the patient safe. Premises and equipments must be safe and available in sufficient quantities. ED must prevent the spread of infection. Staffing and training standards talk about human resources, including all the people that work in the emergency department and beyond, for or with the facility, and they are integral to ensuring the delivery of the quality, patient centered, and safe care in the ED and across the services where an emergency care patient is delivered or diagnosed. The facility must be able to assure the public or patient that it can meet their needs and deliver quality and safe care through a team of dedicated and qualified staff in the ED. The management provides safe physical environment for the staff to work in, which is free from harassment or accidents. The Information, Education and Communication chapter talks about continued medical education that has been considered a paramount in the hospital settings. Training and refresher courses are a regular exercises at the part of the organization. However, additional training to be implemented, which is directed towards the need of the department where the staff is involved. The ED can achieve this by having a training calendar for the clinicians, paramedics, nurses, and non-medical staff. The training should be directed towards the competency need of the department. Documentation and Information Management System chapter talks about the documentation of patient information and patient care that is closely interrelated. To keep up the standard of patient information management is often a task which will be furthermore complex in a chaotic environment of an emergency department. Factors contributing to the failure of documentation and patient information can be inappropriate usage of universally or institution approved abbreviations, illegitimate handwriting, spelling errors, unclear verbal orders, etc. Considering the fact that the failure of patient information management and documentation can lead to fatal adverse events, institutions put a lot of continuous efforts and modifications to safeguard patient information. The continual quality improvement chapter talks about ED. Quality must focus on three quality domains, that is, quality in design, quality in conformance, and quality of performance. There should be effective governance, including assurance and auditing system or process. These must assess, monitor, and drive improvement in the quality and safety of the services provided, including the quality of the experience of people using the services. The system and process must also assess, monitor, and mitigate any risk relating to health, safety, and welfare of people using services and others. The facility must continuously evaluate and seek to improve their governance and auditing practices. Quality indicators should be looking into safety, effectiveness, patient centered care, timelines, and efficacy. Triage, assessment, management, and disposition. The purpose of triage. Triage is used to sort patient by severity to ensure the right care is provided at the right time to the right patient. Systematic approach or recognized psychologically based triage tools should be used to categorize patient as needing immediate, urgent, or daily care. The role of staff is to train staff hospital, including nurses, physicians, must assess patients within stipulated time based on the triage category. Emergency responses. All critically ill patients in the ED must receive emergency sections before any referral or disposition. Referral or transfer. If unable to manage a patient, the hospital must stabilize them to the best of its ability. Documented care should be given and arrange transfer to a high level facility. Emergency medical services. The clear delineation of services, ownership, and organization structures is necessary to ensure accountability to patients, partners, medical oversights, and regulatory authorities. These standards are important for the organization to maximize its own effectiveness and to be responsive to the public. The presence of well-defined clinical standard is an essential foundation to the provision of quality both in hospital and out of hospital healthcare. The EMS services are an integral part of ED, whether outsourced or self-owned, or as a subsidiary through the parent organization. Efficient call taking, efficient resource deployment, and continued communication capabilities are required to maintain an effective EMS. The bike ambulances are outside the scope of these standards as it's not a recognized mode of emergency patient transfer. Medication Management System and Safety (MMS). The purpose of medication management is to provide a framework for safe and effective medication management system. Safe and effective medication management, including the process for storage, describing, transcribing, preparation, dispensing, and administration. All process of the medication management of the ED should comply with rules and regulation of the law of the land. Hygiene and infection control (HIC). Changing technologies and disease profile continue to present a new challenge for infection prevention and control within the healthcare centers. Patients are at risk of developing healthcare associated infections because of the decreased immunity among patients. The decreasing variability of medical procedures and invasive techniques create potential routes for infection and the transmission of drug resistant bacteria among crowded hospital populations with poor infection control practices. Healthcare associated infections are among the most common complications affecting the patients. ED should consider addressing these issues related to infectious disease. The support available by QAI includes training on accreditation standards, type, which is documentation, implementation, verification, and elevation programs, which are designed to help hospital staff in understanding the standards, its implementation, and verification through internal audits or self-assessment, and assessor training programs. Thank you. You can contact us at www.qai.org.in and also mail us at info@qai.org.in. If anyone has question regarding anything, please feel free to answer. Is anyone having any query regarding this accreditation process? Any question can be asked. Any query can be also put in the chat box. Please let us know if any query is regarding the accreditation program of ED, is the training. The feedback form has been shared in the chat box. Please fill the feedback form. If any doubt regarding the accreditation process, essay training is there, please feel free to ask. Chandrakala ma'am, I hope the session was insightful to you. If you have any questions, please feel free to ask. Siddharth sir, if any question, please feel free to ask. I would request everyone to just please open their camera for a group photo. Please, everyone, can you just open a camera for a group photo? Thank you, everyone.